everyone, I am Franz Miss Yap, your second year student nurse from Davao Doctors College. And today I am going to demonstrate to you the perineal flushing. So perineal care involves cleaning the genital and the rectal area of the body. So it is more done or often done when the patient is incontinent. So it prevents from spreading the microorganisms and of course to prevent irritation and odors. So now, first things first, let's prepare the necessary equipment for such as the basin, the warm water, the 7 cotton balls with antiseptic solution, and 7 dry cotton balls, and 2 forceps. 1 is for the picking and 1 is for the working. Then clean gloves, perineal pad, and draw sheet. So preparing the necessary equipment can save time and energy. So don't forget to do hand washing and of course use gloves as necessary. So after preparing the equipment, let's explain the procedure to the client and how she would on how she can participate during the procedure and of course give the client the opportunity to ask or raise for her concerns. And don't forget to establish good rapport so that the client won't feel uncomfortable. Hello, ma'am. I am Franz, your attending nurse for today. So, may I know your name?
Altea Paraiso Nurse.
Okay, so when is your birthday?
February 16.
Okay. So, is that okay that I'm going to check for your wristband?
Yes, ma'am.
Okay, thank you. So, by the way, ma'am, the procedure that I will be doing today is that I am going to perform a perineal care to you. So, is that okay with you?
Yes, nurse.
Okay, so by the way, this procedure is this is to remove some normal perineal secretions and others, and of course to prevent some infection and contamination. So before the procedure, do you have any clarifications or concerns?
Wala naman, ma'am.
Okay, so as you can see, ma'am, the curtains are closed and the doors are closed so that there will be no other people who can see us. So let's go and start the procedure right away.
Yes, ma'am.
Thank you. So first is to ensure to screen the patient's room for her privacy. So now cover the patient's body and feet with a bath blanket, and one corner is at her head and one corner is at her feet and the 2 other corners is on her side. So now let's position the patient into a dorsal recumbent. So ma'am, I will cover your body, ma'am, ha, with this blanket, ma'am, like pati dyan ang yung mga lawas mo. Okay na, ma'am?
Sige, ma'am.
So now, position the patient into a dorsal recumbent and of course, put the patient into a bedpan. So to prevent the bed from becoming soiled, put the bedpan under the draw sheet. So now, drape the patient exposing only the area to be cleansed. Minimum exposure can lessen the embarrassment and of course, to provide warmth. Then lastly, roll the blanket into a diamond shape. Sige ma'am, pwede niyo mo isaka yung mukhang tuhod para sa kuha, ma'am.
Sige, wala problema.
Okay, assist ka, ma'am, ha? Okay, sa tikas po, ma'am. Okay. Okay, ma'am, makuha lang i-expose ang yung genital, ma'am, ha? Okay ra, ma'am?
Sige, kung ulaw, pero sige.
Sige, ma'am. Ay, kaulaw sa kuha, ma'am. Uy, okay ra na, ma'am. Maglimpyo ra, ma'am, punta. Sige, ma'am. Ako para dili buhog ako ang bedsheet, ma'am. Kay ako nang sudan, ma'am, ha. Ibutang ang kaning draw sheet sa imuhang lalo. Huwag kira, ma'am.
Hindi okay na.
So, pwede niyo masaka imuhang tail, ma'am.
Sige.
Sige, ma'am. Karon, ma'am, ibutang ako sa imuhang bataks ang kuan, ma'am, ha. Ang kaning bedpan. So before cleaning the area, let's first use gloves. So now I am done putting some gloves on my hands. So ma'am, tanawon ako ang imuhang genitalia, ma'am, ha?
Sige, wala po na.
Okay. So now let's inspect for the perineum and flush the perineal area with water. So no particular area of inflammation, swelling, excessive discharge, or secretions from the orifice, and presence of odor. So warm water is used to prevent chilling or soften or dissolve the blood clots. So first, let's inspect her genitalia. So ma'am, tanawan ako, ma'am, ha? So as you can see, there's no any inflammation or secretion on the orifice. So ma'am, magbutang na kog tubig sa imong genitalia, ma'am, ha? Ina ko bugnaw ra kayo para sa imuha.
Sige.
Ma'am, okay ra, ma'am? Kabugnaw.
naman.
Medyo warm water man ni siya, ma'am. So, dili kayo siya na nakabugnaw ang tubig. So now, get cotton balls soaked in a cleansing solution using pick-up forceps to maintain the sterility. So now, let's cleanse the external genitals starting from the midline of symphysis down to the anus. So never retrace a stroke to prevent contamination of the area. So ma'am, magsugod na ko kahit sa genitalia ni mo, ma'am, ha?
Sige.
So now with the second cotton ball, cleanse starting from the mons pubis in a figure of 7 by the external labium towards the anus, then discard. So secretions that tend to collect amount of around the labia minora facilitate the bacteria growth. Then do likewise on the opposite side to the next cotton ball. So now with the fourth cotton ball, cleanse starting from the mons pubis in figure of 7 by the external labium towards the anus. Then discard, and of course do likewise to the opposite side with the next cotton ball. So now with another cotton ball, cleanse the groin starting from the groin going up to the thigh. So use the other side of the same cotton ball for near groin. Then of course flush the perineum thoroughly with sterile water. Ma'am, mag-flush ko balik sa imuhang genitalia, ma'am, ha? Sige, may na lang ko magbugnaw ra ba kaayo siya. Pero, medyo init-init man siya. So now, using the 7 dry cotton ball, dry the perineum with the same stroke as above. So moisture supports the growth of many microorganisms. So now let's remove the bedpan gently and turn the patient to the side. So ma'am, tanggalon na ako ang bedpan, ma'am, ha?
Okay, ma'am.
Sige, ma'am. Yun ako. Okay. So now, let's turn the patient back and make her comfortable. So ma'am, okay na ta, ma'am. Ako alang ibalik ang imuhang kuan ka ganina, ma'am, ha? Position ni mo, ma'am. Pwede na nimo ibaba imong tuhod. Sige, ma'am, tanggalon na ako ang kuan, ma'am, ha?
Sige.
Paano i-cover bali?
Humana ta, ma'am.
Yes, ma'am. Humana jud ta. Sa wakas. So now, spray with antiseptic as needed to promote healing. Then now, let's put some perineal pad with an up-down motion as needed to prevent the contamination of vagina and urethra from the anal. So, ma'am, magbutang kong perineal pad sa imo, ha, ma'am, ha?
Sige.
So, ma'am, humanatang, kamusta man ang imong gibati?
Okay ra, ma'am.
Medyo-
Ako paminaw sa kukuan.
Okay, so maayo na, ma'am, no? So, humana jud ta, ma'am. Pwede na ka makapahulay karon.
Sige, salamat tayo.
So now, do the aftercare and of course, do hand washing. So document or record the procedure done to the patient and discharges observed.